View it as a vitamin, view meat as a vitamin supplement that is toxic in large amounts that you eventually want to taper off your diet. When you take, if you've got an pneumonia, you tend to take antibiotics. There comes a point where enough, you don't need them anymore. Just stop them, taper them off. Same thing, blood pressure pills, etc. Meat should be looked the same way. I tell them if you're going to be eating that, find the smallest amount of meat that seems to meet your requirements. Eat it as seldom as you can. You only need to eat this stuff once. Nobody needs to eat animal flesh 2-3 times a day. That leads to disease and death. Now, if someone once a week or twice a week in the initial phases of becoming vegan needs to feel better, a little animal flesh, but tell them this is toxic stuff and really be consistent in trying to stretch out the interval. I wish someone had told me when I was a medical student or a medical resident that type 2 diabetes is reversible. We get the opposite message. One's on insulin, always on insulin, nobody gets off. High blood pressure, they'll take these pills the rest of their life. This is lifetime medication. It's right, doctor, if you don't talk to them what they're eating, that's what you're going to see. But it doesn't have to be like this. Get these people on a whole plant diet and the arteries open up, the high blood pressure comes down, their insulin receptors that were all clogged up with fat open up, and their own insulin starts working fine, and their blood sugars come down.
Hi, everyone. Welcome to Best Life by You, the podcast dedicated to helping you overcome challenges around nutrition, mindset, training, relationships, and, well, all of the above. I'm your host, Julia, and today we have a super special guest with us. If you can't recognize him already, well, you're going to be so surprised and so excited to hear everything about Dr. Michael Klaper, who we have with us today. So, yay, welcome.
Thank you. It's good to be with you.
I'm so excited. So for everybody listening who does not know Dr. Klaper, I've been following him for years. Huge fan, and I love what he practices, and we're going to get into it a little bit more. But just so you guys can be aware of what he does. So Dr. Klaper is a gifted clinician, internationally recognized teacher, and speaker on diet and health. In addition to his clinical practice and private consultations with patients, he is a passionate and devoted educator of physicians and other healthcare professionals about the importance of nutrition in clinical practice and integrative medicine. He's the author of the new book, Moving Medicine Forward, as well as Vegan Nutrition, Pure and Simple. He has produced numerous videos, webinars, and dozens of articles for both scientific journals and popular press. As a source of inspiration, advocating plant-based diets and the end of animal cruelty worldwide, Dr. Klaper contributed to the making of 2 PBS television programs, Food for Thought and the award-winning movie Diet for the New America. He teaches that health comes from healthy living and is dedicated to the healing and flourishing of all living beings and our planet. So, what an introduction. I'm so excited to have you here and to really I know that bio probably is a shortened version of everything you've done, considering that I met Dr. Klaper back in 2023. I had gone to the Veg Summer Fest in Pennsylvania. I watched him teach seminars. And so I would just love to dive in about your experience in being in the world of medicine, lifestyle practice, and then, of course, talk about your new book. So where did all this inspiration come from for you to be plant-forward and plant-based?
Well, thank you for that lovely introduction.
Of course.
I'm a classically trained Western physician. I graduated from the University of Illinois College of Medicine in Chicago. I've taken postgraduate training in surgery, anesthesia, obstetric at the University of California, San Francisco. And for the first 10 years of my career, I practiced blood and guts medicine. I thought I'd be working in emergency rooms and operating rooms and general practice offices for my entire career. And during the first 8 years of my medical career, as I was practicing standard general practice, really adhering to the best guidelines of trying to keep blood pressure down and keep blood sugars under control. while I was failing, my patients were getting fatter and sicker. They're getting heart attacks and strokes, despite my admonitions to take your blood pressure pills and take your insulin. And I'm raising the dosage of medications these folks, and they're still doing terrible. I got so discouraged, I left general practice. I felt like a failure,
Mm.
and I decided to become
Oh.
an anesthesiologist. And the third year of my anesthesia training, I was on the cardiovascular anesthesia service, dealing with people's hearts and blood vessels. And every day I'm putting people to sleep and watching surgeons open their chests and open their coronary arteries and pull this yellow guck out of their arteries called atherosclerosis. Well, it's clearly the fat of the animals these people are eating. And there were already studies in the medical journal showing that one, was largely the saturated fats and cholesterol in their diet. And second, a plant-based diet can usually melt these plaques away unless there's some genetic issue with their lipid balance. And then my dad died of clogged arteries. I know I've got those genes. And I was getting messages in the operating room to change your diet to a plant-based one. So I did.
Hmm.
I adopted a plant-based diet. My body loved it. Within 12 weeks,
Yeah.
20
Wow.
pound spare tire of fat melted off my waist. My high blood pressure went to normal. My cholesterol went to normal. I felt great waking up in a nice lean body every day. And at
Yeah.
that point, I realized why my patients were all getting fatter and sicker in general practice from what they're freaking eating every 4
Yeah.
hours. Standard
Yep.
diet, meat and dairy and oils and sugar. And,
Yeah.
and so I realized I didn't want to be an anesthesiologist and spend my career putting people to sleep. I'd rather go back to general practice and help them wake up, right? And
Yeah.
so I did, and found people in my area who could give plant-based cooking lessons. And those who could make this change, they experienced the same wonderful changes that I experienced there. They lost weight, their blood pressures came down, their cholesterol came down, and I was able to get them off their medications. I was able to stop their insulin, stop their blood pressure pills. I became the happiest doctor I know. My patients
Oh.
and so there's no going back. You can't unring the bell once you see that. There's no going back to standard medical practice. I've become a plant-based physician ever since. And my focus is, someone should tell the medical students about this
Yeah.
before pharmacosclerosis sets into their brains, and they think that
Yeah.
drugs and surgery like treatment. So for the past 4 years, I've been going to the nation's medical schools and giving them my lecture, what I wish I learned in medical school about nutrition,
Yeah.
and letting them know that the diseases they're facing are largely reversible, and a plant-based diet is to keep reversing them.
Hmm.
And I tell them you can become the happiest doctor you know by incorporating healthy plant-based nutrition into your medical practice. So someone said you ought to put this into a book. So that's what we
Yes.
did here. And so the result is moving medicine forward, which we're trying to get into the hands of medical students and young doctors across the country.
I love that. I have a few friends who are going into medical school and they're not plant-based. And they know I'm a huge advocate. Like any person that knows me, when they think of plant-based, they're like, Julia, we know her. We know her. But Julia's it. Julia's the girl. And I'm in Westchester, New York. So there's a lot of people around who focus on I live in such a busy city where everybody's like, what's the quickest? What's going to get me through? Caffeinated, no stopping. And I kind of fall with that grind I'm a business owner. I'm on the go. I have my coffee and I am very cognizant of what I put in my body. And I've led talks to, I have a coach handbook out called the 7+ Lifestyle. And for me, it's just a basic, coaching handbook to educate people about how to pretty much like alkalize their diet. So my purpose behind the book was to, without saying eat more plants and go vegan, it's a strategic way of saying, hey, here's a way to get above 7 on the pH scale. If you're looking at alkalizing your life in regards to habits, what are healthier habits and things that are going to be good for us? So it's been, for me, I think there's been a lot of pushback, and this is something I know we spoke about before on the call, and we're absolutely going to dive into your book. But before I had a couple days ago, I had a conversation with this guy who used to be plant-based. And I've actually met quite a few people who have been plant-based or vegan for years. And then on countless occasions, one girl said, she's like, I felt so much better when I started eating meat again, which in my head, I'm like, well, you weren't doing it right. Cause like you can get all your nutrients that you need. And then the other conversation I had with somebody else was that, he was plant-based for years and then he ended up just trying to find a balance. He felt amazing being plant-based, never felt better in his life, but then had this pressure of like, no, you actually like, why don't we go back to basics of drinking milk? And especially with the new food pyramid that's out of like, drink your whole milk, drink all this. Like, how do you navigate conversations like that? Like for me, it's hard because I don't have the dietitian role or I don't have the doctor role. So it's more like, and I'm a very factual person. Like I have the research, I have my whole top shelf of my bookshelf is all plant-based books, doctors, everything. I have Gregor's book. I have, oh my gosh, I have countless books. I know I've listened to yours. I have a bunch of audiobooks. I have every book that you could think of for research. So how do you go about navigating those conversations of someone who maybe was plant-based and then they're like, well, I felt so much better, or this helped me feel better and more alive? Like what? Because for me, I've struggled and my typical response is like, you're probably missing out on essential nutrients. That's why you don't need meat. You need protein. Don't need, fish. You need omegas. Like that's the alternate. So I'd love to hear how you go about that.
It's a very complex
Loaded, right?
and powerful issue that that
Yeah.
you and I both have to deal with. We both have this coming up again and again.
Mm-hmm.
And I have to, be a bit humble and say, these people may be trying to tell us something here that we do need to understand. And so I look at the situation like this. First of all, there's no question is by our anatomy, our physiology, we are plant-eating hominids, just like our gorilla cousins who build these magnificently muscular bodies on plant-based materials only. They spend all day shoveling meat and shoveling the leaves and fruits and vegetation into their mouth. They build these great muscular bodies, and they do not develop clogged arteries, high blood pressure, type 2 diabetes, colitis. The plant eating hominids, and so are we. We've got fingers on our hands, not claws. We don't have big fangs coming out of our
Yeah.
mouth. We don't have,
Yep.
the digestive enzymes in our saliva are starch digesting enzymes. If that is not a message from the universe about what we ought to be eating, the very first digestive process that gets started for food assimilation is again breaking down starches. So it's clear we're plant eating creatures, and I wouldn't tell a giraffe or an elephant, you need to start eating chickens. I mean that's bizarre. But, these are plant
Yeah.
eating creatures that develop very muscular bodies without all that. That said, so what about these people's experience? And I have to believe they're being honest. So taking the long view, I'm saying, these are people often in their 20s and 30s. So for the past 20 or 30 years, none of them
Mm-hmm.
were raised as vegans. And so the last 20 or 30 years, they've been eating animal flesh every 4 to 6 hours. Bolts of animal muscle go through their tissues. In that animal muscle are certain nutrients, creatine, which we can make. But if it's coming in pre-formed every 4 hours, your liver and your bone marrow might say, hey man, we don't have to make this stuff. It's always in the bloodstream. And so one's own production of carnitine, creatine, and it's not a matter of going out and taking carnitine supplements. These are, there's hundreds of nutrients that are in the cascade of reactions that happen when you eat any nutrient there. And so their production of a lot of nutrients, a lot of chemical reactions involving vitamins, involving these particular nutrients may be depressed because, again, these nutrients are always in the bloodstream. Then they go vegan, boom, and suddenly wife says, okay, you got to make all these nutrients on your own, make your own carnitine, your own creatine, your own B6, whatever, and or B6 nutrients involving vitamin B6 or
Yeah.
chemistry. And now the body may not be able to gear up right away to produce all these optimal levels. And then when people they eat some meat and the carnitine, creatine, all that floods into their tissue. Oh, I feel better. Oh, I'm a carnivore. But what are we looking at? This is not normal physiology. This is
Hmm.
an acquired dependency created by feeding a human infant animal flesh 3 times a day for 30 years. So yes, you can create this dependency. Well, la-di-da. What do we do with that? Because those very same nutrients, as you know, especially if you eat them in quantity, you're eating saturated fat and cholesterol and a lot of substances that over time
Yeah.
start contributing to disease.
Yeah.
So these people have themselves hooked on the horns of a dilemma. The tiger by the tail. You're afraid to release the tail because the tiger's going to eat you. They're afraid to stop eating meat. So what do I do? Knowing that the human body is absolutely capable of running out plant-based fuels, especially if you raise a child as
Yep.
a vegan.
Yep.
They don't have meat cravings. They don't want to be taking carnitine supplements. They're doing just fine with their plant-based physiology. So if you are hooked on this stuff right now, then view meat as a vitamin supplement that is
Hmm.
toxic in large amounts, and that you eventually want to taper off your diet. If you've got pneumonia, you tend to take antibiotics, but there comes a point where enough, you don't need them anymore. Just stop
Hmm.
them, or taper them off. Same thing, blood pressure pills, etc. Well, meat should be looked the same way. And I tell them, if you're going to be eating that, find the smallest amount of meat that seems to meet your requirements. Eat it as seldom as you can. You only need to eat this stuff once. Nobody needs to eat animal flesh 2-3 times a day.
Yeah.
That leads to disease and death. But if someone knew once a week or twice a week in the initial phases of becoming vegan, needs to feel better, a little animal flesh, okay. But tell them this is toxic stuff, and it's really be consistent and try to stretch out the interval. Instead of eating it twice a day, which is better than or twice a week instead of twice a day.
Yep.
Maybe you only eat it once a week. Find the small stuff, and then finally go without it for a while and say, hey, you don't really need the stuff. So,
Yeah.
these people may have a dependency because their mother didn't know, your mother didn't know, my mother
Yeah.
didn't know.
It's
We
true.
all get fed this stuff, and you can become really dependent on it. And that's probably what we're looking at, but it's still destroying our arteries. It's destroying these people are opening the door, especially the carnivore folks, the paleo folks. Packing your intestine full of animal flesh 2-3 times a day is a recipe for an epidemic of colon cancer as you smear these carcinogens on the gut wall, of autoimmune disease, all the endotoxin in the meat, your leaky gut. These folks are going to get lupus and autoimmune diseases. Certainly, they're going to get atherosclerosis. They're going to get heart attacks, strokes. They will get they'll get a vascular dementia. They're going to get ulcerative colitis. A meat-based diet spawns microbes in the gut that inflame the gut wall. They're opening the door to a whole host of really lethal disease. 22, you think you're going
You
to
don't
live
think
forever,
that. Yeah.
it doesn't matter what you eat. Yeah, well,
Yeah.
your body's never not looking. Your microbiome is different with every meat-based meal. You got different microbes down there. It does change your body in not good ways.
Hmm.
And we're seeing colon cancer in younger and younger
Yep.
people. We're seeing heart attacks and strokes in younger and
Yep.
younger people. Stop kidding ourselves that this is
Yeah.
in any way a healthy diet. No primate eats animal flesh 2-3 times a day. We certainly shouldn't either. So we might be looking at an acquired dependency here. So help them like a heroin addict, help them taper off of this stuff. But it's just not
Yeah.
worth getting into conflict. They're stuck on the horns of this dilemma, but we can help them get past it.
Yeah. And that's something I was going to add on is my focus has been with a lot of clients because for some reason, if you say vegan or plant-based, they got, oh, I'm offended. This is too much. So what I've been phrasing, because I'm learning a lot of the language and what's going to get through to clients, is I have them focus on fiber. So I'm like, okay, what kind of fiber source are we having? And how do we go about that? Now, here's the biggest thing. Because I'll explain two sides. I've seen people, and I have not worked with them because I would microdose the fiber intake of like, hey, we're going to eat a bowl here. If you are eating 5 grams of fiber, I'm not going to have you eat 20 grams of fiber. You will hate yourself and be bloated and gassy and everything, and especially paired with water. So I've met people who are like, yeah, I've gone plant-based. I did it for 2 weeks, or I did it for the month of January, and I felt awful. And this was years ago when I wasn't as well crafted with my language and education around this. And I'm like, oh, that's unfortunate. Now my language is, well, you probably went from 0 to 100 with fiber. And fiber is one of those things the gut loves. Like, we are feeding our body, with whole foods. And that's another way to say it, is like fiber, you're having the whole foods, right? Your grains, nuts, fruits, berries. And so what I've been doing with my clients is increasing their fiber slowly to help them. Being like, okay, this week, let's go ahead for lunch. Instead of having your salmon bowl, let's go ahead and do chickpeas, black beans, go ahead and do quinoa, go ahead and add some cilantro, do a little bit of broccoli, add a little bit of lemon juice on top. And let's start with just a bowl of that. And that will be like the one fiber thing they have in the day. Because if we continue on of saying, nope, you're changing, you're starting from scratch. You're going from 100% your sad diet to eating 3 huge plant-based meals a day. Yeah, your gut is probably going to be struggling with it. And yeah, there's digestive enzymes. There's things you could take, but you don't want to be doing that to yourself. So what I've learned to do with clients that has worked well is increase fiber slowly and increase it to a point where, like, I get 80 grams of fiber a day because I enjoy tracking. And if I don't, I feel it. And sometimes it's more, sometimes it's less. But the average person, and you can correct me, is what? Getting 10 to 15 to 20 grams of fiber a day? Maybe if that. And what happens with the fiber, and again, correct me, but a lot of dietitians that I've followed in the sports nutrition world, a lot of them are pushing for balanced plate, right? Like, let's have a balanced plate. This is going to be some chicken on top of a bowl. And the whole purpose of fiber is to link on to the cholesterol in the body, move along the cholesterol out of the body to lower your cholesterol levels and stay hydrated. That has been a huge thing I've seen, that a lot of people are like, yes, focus on balance, no restrictive dieting. I want to be able to eat my chicken and have my wine and eat my fiber, because there is a dietitian I follow who is a huge push on fiber, yet she'll go ahead and make steak meals and make these things. And I'm like, and she's like, doesn't matter because my fiber is so high to push out the cholesterol in the body. So how would you navigate or like go about a conversation like that? Like, have you been faced with that? Because that's something that, and it could be something you talk about in your book to educate people, but that is something that I've seen more and more on social media, dietitians pushing for, of like the balanced plate. You want to have high fiber, but you can also have your chicken and salmon and all this. So yeah, sorry that was loaded, but I was like, I cannot wait to talk to a literal doctor, somebody who is specialized in this, about it, instead of the person who's getting a degree on social media. So talk to me about a little bit about that.
Right. Dr. John McDougall had a favorite saying: people love to hear good news about bad habits. And,
Yes.
dietitian says I can eat all the meat I want.
Yes.
And
Gosh,
also
yes.
get all they hear, um,
Mm-hmm.
old Paul Simon in one of his songs says, man hears what he wants to hear and disregards the rest. And that's what we're saying here. Because people like to taste the steak and they like to taste the chicken. And if there's any way to, they only give that up.
Yeah.
But meanwhile, our microbiome down there doesn't care about what you like. They're just got to deal with all this decaying animal flesh, and you're going to spawn a whole population of microbes that, again, make it more and more colon cancer, more high blood pressure, etc. So how do we approach this? Well, I'll give the dietitian credit. At least they're mentioning the F word,
Yes.
and so good for them.
I love the effort. It's my favorite one.
Absolutely. And I really I have to commend you. All of us who've been in this nutrition game for a few years now, we all have got a little more experienced, and we've tailored our guidance to people. Well, before it was, as you said, 3 meals a day. Paul,
Yeah.
plant foods, and people wound up bloated and gassy, and I can't do this. And so
Mhm.
you and I have both learned that if you're at the stoplight in your car, it's just idling. When the stoplight turns green, you don't slam the accelerator to the floor and screech away from the. Yeah, easy does it on the accelerator. And the same thing
Yeah.
with the fiber.
Yeah.
Be gentle with your microbiome. Put in those. Start with as you're going to increase the fibers. Do so with the non-starchy vegetables that don't have a lot of sugars in them, that aren't going to feed the gas-producing bacteria, and so the foods that you mentioned there, the quinoa, chickpeas, and broccoli, these have fiber, but again, they're not going to be gas producing so much.
Yeah.
And give your microbiome similar to the car at the stoplight. Give it a few weeks, give it a few months to slowly start changing into
Yeah.
ones that can handle the fiber without producing lots of gas and bloating and distress. So easy does it as you introduce the fiber. There's no hurry. Nutrition is never an emergency. You don't have to do this
Mhm.
all tomorrow. Right? When we were teenagers learning to drive, where we really horse the steering wheel.
Yeah.
After a while, you learn it's just small corrections, and driving down the
Yeah.
highway will keep you on the center of the road. And the same
Yeah.
thing with nutrition here. So, so the fact is, again, you eat animal flesh 2-3 times a day. Yeah, and when you're dealing with young people, they don't want to hear you're going to get cancer when you're 40. 40 is never going to come.
But it's a repercussion of what they do in their 20s and 30s. I've said this. I'm like, I'm 30 years old, and I'm like, what I did in my 10s, 20s, 30s is going to come up in my 40s, 50s, 60s. So people
Yeah,
with back pain, people with, oh my gosh, I have so much pain, my back, my joints hurt, my this hurts, my this hurts. Well, what do you think it's from? You think it's just because you turned 50? No, that's not how it works. It's a repercussion. So, sorry, I interjected. Go ahead.
no, that's absolutely appropriate. And so again, meat. We are not flesh-eating primates. We have no need to be eating animal flesh at all, let alone every day.
Uh-huh.
So we're going to point out, and the more meat you eat, there's clearly shown red meat is sort
Uh-huh.
of parallels the mortality rate. The more meat you eat, the higher your risk of dying early from heart attack, strokes, cancers, etc.
Yeah.
There's lots of studies now showing that. Just do a Google search on red meat and mortality, and you will see the
Yeah.
study showing clearly. And so your dietitian friend will say, "Oh, you can eat mouse, steak, and chicken." But what kind of concern does she have for the long-term health of her patients? It
Yeah.
doesn't really fit in there. She's really curious about that. Again, so a whole plant diet with the smallest amount of meat you can incorporate to maintain your function, with the intent of tapering out of your diet altogether. Nobody really needs to be out of it all their lives.
Yeah.
So tell her, she's opening the door to serious diseases. If she cares about her patients long term,
Yeah.
to recommending me to daily is irresponsible as far as I can see.
Yeah, I think there's a lot that doctors, I'm sure you're in your book, will talk about. And there is something that I tried to explain because I've given presentations on educating people on plant-based, and a way that I've tried to explain to people. And I've done demos with like straws and saying, this is an artery of somebody who eats plant-based, this is somebody who eats meat. And then if you were to drink water through one of these straws, which one would you prefer? And people are like, I want the clear one. I'm like, why do you want the clear one? They're like, well, everything's going to get to me so much quicker and easier. So I'm like, okay, well, and you could correct me, but I'm saying like with the arteries, plaque is starting to build up, harden. So then when blood needs to pass through with all the nutrients, it takes a lot longer to get to the places it needs to. So that, and again, the conversation, like correct me, with like the terminology, but I've explained it to people of like, athletes, I work with an athlete right now. I'm like, we want to eat. I mean, he does like 80% plant-based. Like we do all lunches plant-based. He has 2 meals a week that have, I think, meat in it, and 2 meals a week that has it because that's his preference. And I'm trying to just educate him and bring more plant-based into his lifestyle. So, but he does know it's important to eat more plants. And it's hard because a lot of people are like, no, you can have the balance of the steak and this, but I've explained like athletes are working under so much more pressure. They're moving their bodies so much, the blood flow increases. And if their arteries are getting blocked, isn't that going to be harder for them to perform well?
Oh, absolutely. Blood
Yeah.
flow is life. There's no question, especially blood to the brain and the muscles. If you're an athlete, is really key. You want to keep those arteries as wide open as you possibly can.
Yeah.
Uh, you and I, if we could uh, push a button and make the whole world vegan, we probably would be on it with both thumbs. Because you and I know that a meat-based diet is not only killing our population off, but billions of animals, and the earth itself is suffering. Cutting down the forests and drying
Yeah.
up the rivers to produce all this meat. We really need to shift gears here and make people feel really positive about shifting to a plant-based diet.
Yeah.
So there's a real passion behind our advice, but it's scientifically sound. There's lots of plant-based athletes. I'm sure you probably recommend your
Yeah.
client see the Game Changers movie and see all these
Yep.
magnificent vegan athletes performing all these wonderful athletic feats.
Yeah.
It's clearly, it's a doable strategy, but again, these are comfort foods. My dad
Yeah.
makes steak every Sunday night. We grilled big
Yeah.
steaks there, and it's locked in with those memories that we have from childhood. And it's a hard thing to overcome. We have to have a lot of compassion for our friends. The fact,
Mhm.
uh, the fact that they're contemplating it all, more plants is wonderful. There's an old saying that when the dog plays the violin, don't criticize the quality of the playing.
Yeah.
The fact that he's playing it all is wonderful. The fact that
Yeah.
he's supposed to read more playing, good for her for recommending it.
Yeah.
But then she needs to see the study showing the more meat you eat, the more you're opening the door to colon cancer and strokes. And she needs to be honest with her clients about that.
Yeah, and there is evidence-based. I mean, we're gonna switch gears to talking about your book. The evidence-based, oh my gosh, research shows that the plant-based diet is the only one to reverse heart disease and prevent cancers. So a lot of people will push against that and be like, no, there's research on this. And I'm like, you mean on rats? Is it on rats that they did the studies? Or like maybe 5 people did the study and they felt great eating meat? Like, I know that that's my purpose because I love research. I love evidence. And that's also why my mom had colon cancer. That is why I went vegan, because I wanted to prevent certain cancers and diseases. So for me, that was a huge part of my why of why I did this. And I think a lot of people are just not as informed. And I'm excited to hear like about your book and how it breaks down. What can people expect? Is it for a particular audience? So I would love to just give you that time to kind of overview your book so people know what they can expect. And should it be a book that a first time person who's never heard plant-based should be reading? Like what do you recommend for that?
Thank you.
Of
Well, my
course.
book is largely aimed at the health audience, the health provider
Yes.
audience, doctors, dietitians, nurses, etc.
Yes.
Because we're in clinic every day seeing this river of patients, and the majority of them suffer common problems. Most of them are overweight, if not clinically obese. Half of Americans are going to be obese.
Mhm.
Everything clogged arteries, high blood pressure, type 2 diabetes, and a host of inflammatory conditions, lupus and arthritis, etc. And the vast majority of these come from our standard Western diet that runs a steady river of meat and dairy and oils and sugars and processed foods through our bloodstream hour after hour, day after day. And we don't talk about diet. In medical school, the patient's diet is virtually never mentioned. The professors weren't taught anything about it, so they don't teach the medical students. And I think there's an intellectual laziness. Oh, well, nutrition, that's cultural. Yeah, I'm not going to tell a Hispanic patient or a South Indian patient what they ought to be eating. That's their business.
Yeah.
And so then, another reason not to mention the patient's diet. But of course, these diseases affect people of all nationalities and all cultures. And so the patient is put on all these powerful medications to pound on their cholesterol and pound down their blood sugars and pound down their blood pressure, not getting and it's embarrassing. Medical scientist, every doctor's a medical scientist. They don't ask, what am I looking at? Why is their blood pressure up? Why is their cholesterol up? Why is their heart? It's the food, doctor. It's what
Yeah.
they're eating. Stop eating or get your head out from under the rock. It's the food. It's the food. It's the food. Yeah, and because doctors are just nutritionally naive, he needs to reach the medical students about this. Because again, the main message of the book is that the majority of these chronic diseases first of all, they're reversible diseases. Wish someone had told me when I was a medical student or a medical resident that type 2 diabetes is reversible. We get the opposite message. One's on insulin, always on insulin. Nobody gets off insulin. High blood pressure, they'll take these pills the rest of their life. This is lifetime medication. That's right, doctor. If you don't talk to them about what they're eating, that's what you're going to see. But it doesn't have to be like this. Get these people on a whole plant diet, and the arteries open up, the high blood pressure comes down, their insulin receptors that were all clogged up with fat open up, and their
Mm-hmm.
own insulin starts working fine, and their blood sugars come down. And not only can you get these people off their insulin, you have to get them off because they lose
Yeah.
weight, the receptors open up, and they keep injecting insulin. Their blood pressure is going to drop dangerously low. Same thing with the blood pressure, folks. Not only can you get them off their blood pressure medication, but they lose weight, their arteries open up, their pressure comes down. You have to get them off, or else you're going to get the calls like I was getting early in my career. Patient said, "Gee, doc, I'm standing up, I'm getting lightheaded, I feel like I'm going to pass out." That's low blood pressure from your
Yeah.
medications. Don't have high blood pressure anymore. Stop your medication. As soon as
Yeah.
I said those words, I looked around, I thought there was going to be a puff of smoke, and the ghost of my internal medicine professor appeared saying, "What did you say? Stop blood pressure medicine? No one does." Yes, Donald, you have to. So
Yeah.
that's one message of the book. These are reversible diseases, and a plant, and second, a plant-spawn diet is the key to reversing these diseases. Know those two.
Mm-hmm.
I wish every medical student knew that going through their medical education. So that's the main message of the book. And there's a great book to give a medical student, to give your family
Yeah.
doctor.
Oh, I plan to. I plan to.
The patients should read this. They should know what their doctor should be asking in the medical visit. I think chapter 5 is a day in the disease reversal clinic.
Wow.
It creates the
Yeah.
disease reversal clinic, which every hospital should have in the very
Yeah.
near future. Every doctor's office should be a disease reversal clinic. But I adopt the voice of the chief resident on the disease reversal service, and I welcome the young students and the residents in. And we talk about how the plant-based diet reverses these diseases. So they see the solid science. Oh, right. That this is not California woo-woo stuff. There's solid science about how a plant-based
Mm-hmm.
diet with plaque and lowers blood pressure and actually creates these beneficial changes. Every doctor needs to know that. So
Mm-hmm.
we're trying to create a new generation of of nutrition, diet aware doctors, first of all,
Yes.
and who understand that a plant-based diet is exceptionally powerful in reversing
Yeah.
these diseases. That's the thrust of the book. So yes, it's both for doctors and for their patients, and hopefully you can't unring the bell. Goethe said, "What you know about, you see." Once you know about it, you start seeing it everywhere. And
Yeah.
put that awareness in the mind of all practicing doctors, especially the new ones that are coming out.
I'm so glad you say that because I've worked with a plant-based dietitian before as of like I worked at a company with her, and I remember I was pondering I am a very vocal person and very much will fight people of like research and information. Um and she had told me, I was like, yeah, I'm pondering like going to go be a dietitian. Like I love nutrition. I've done like the Cornell program that is offered any nutrition certification, which some of them are horrible online and not accurate. And I told her, I'm like, I am pondering like going into it. And she's like, I'm going to tell you, you're going to have to keep your mouth shut through many, many courses. And she's like, do you want to be paying for something where you have to keep your mouth shut and just intake information? And I was like, no, I don't have the patience for that. So my thing is being a plant-based advocate and educating. And I used to be an educator, and I've given examples and talks of increasing like your plant foods and how to do that. And I provide tons of resources, tons of education just to educate people on it. And it's sad because I actually had a friend, she had no energy all the time, really struggled. And we had met up a while ago. She's a mom. And a dietitian had told her, not kidding, that she had low energy because of her iron and that she was to eat steak and butter every day. Every day. I had to stop myself and I said, pause. A dietitian told you had to have steak? And she's like, yes, because it's packed with iron. I was like, there are tons of other foods that are packed with iron, magnesium, and all the good things that you can get without the saturated fat or dietary cholesterol or anything dead. And she's like, no, I like don't know that. And I wasn't even offered that. So I'm sitting there listening to this after a dietitian told me. And actually, I will say, I've had a few people, because I run an online coaching program. I help people transform, bring awareness to nutrition, transform their bodies, mindset, all of that. That's my online coaching program. And I've worked with clients who have literally gone to dietitians and come to me and they're like, I had a dietitian tell me to eat this standard thing. And they were like, I have so many digestive issues. And why am I, somebody who's not a dietitian? Yes, I am very educated, very well informed. I continue up with like my continuing education. I'll take additional courses online to learn about nutrition, plant-based nutrition. So I'm always staying informed. But I'm like, why am I somebody that needs to bounce back? I'm not a dietitian. And yet people who worked with dietitians are coming because their health got fucked. So like, excuse my French, but I'm like, why is that? So I'm so glad you have a book that's coming out to educate these practitioners, because it's not everybody, but it's a lot of them. And like even having to explain to people soy. I've even had my own personal experiences of working with naturopaths where naturopaths are like, you can't do soy, like it's way too much estrogen. And I'm like, no, it's a phytoestrogen. It's different than the human estrogen. Like, yeah, they might have similar compounds, but I'm like, it's not the same thing. And they're like, yes, well, there is a lot of things, like people think that. And then I sit there and I'm like, you're the professional here. Like, there's a lot of misinformation and miseducation, I guess, around that either people don't know or they choose not to listen because they are afraid that they have to unlearn learned behaviors. That's what it is.
Yeah. I agree with you absolutely fully. And up to this point, the profession of registered dietitian has not been a positive force in the national health for the reason you say. Throughout the 1940s, 50s, 60s, 70s, all throughout the 20th century and well into the century, the dietitians largely been mouthing the party line from the meat and dairy industry, and you had servings of meat every day and 3 glasses of whole milk, which we've reverted to in the current dietary regimen.
Which is a headache.
That said,
Yeah.
dismal and distressing as that situation is, it turns out in the last 10 to 20 years, there has been an awakening among the
Good.
dietary profession of the power of plant-based nutrition to support
Good.
reversing diseases, and we're getting more and more true plant-based dietitians, vegan dietitians. And I urge people, do a search for vegan dietitians in
Yes.
my state. And we spend a lot of time in the book on this very thing. And I tell in the book, when I'm talking to the young doctors, and I'm saying, here's the way medicine should be practiced in the 21st century. Now, when you see your patients in your office or in the outpatient clinic, be a good doctor, take a medical history, do a physical exam, order your lab tests, view the scans. And if necessary, get a diagnosis, and if necessary, put them on medications. Absolutely control those symptoms, make sure the patient starts getting better. Knowing that it's largely the diet that they're eating. Before you dismiss that patient, if they come back in a month, you give them a little slip and say, this is the contact information for Ms. Jones or Mr. Smith. They are plant-based dietitians. I want you to contact them and do a telemedicine consultation with them. And they're going to talk to you about what they eat. They're going to send you handouts. They're going to watch videos with you. They may meet you
Perfect.
shopping, and they're going to get you on a plant-based dietary program. You eat like they're telling you, and you come back and see me in a month. Let's see if you're leaner and healthier. We'll talk about getting you off some of these medications. I say that's how medicine should be practiced. Instead of holding the dietitian at arm's length, then conventional doctors just treat the dietitian as an afterthought. Yeah, send them to dietitian, we'll give them a diet, don't bother them. No, doctor, the dietitian belongs on the primary care treatment team. She's the one, or he's the one
Yeah.
that will actually make the healing diet happen.
Yeah.
And so don't let your patients go out without a referral to a plant-based dietitian. And more insurance plans are paying for that. But even if the patient has to pay for one or two consultations for the plant-based dietitian, then
Yeah.
they should hire a health coach. I'm a big fan of plant-based health coaches
Yeah.
because the dietitian doesn't have time to talk to them about how to
Yeah.
steam broccoli, how to
That's more me, like what I
but the
do. Yeah.
coach does, and it's great to have a health
Yeah.
coach on your team. Again, just for a couple of months, after
Yeah.
a while, you know how to ride the bicycle. You don't need
Yeah.
well temporary, but it helps them make that transition to a healthy
Absolutely.
plant-based lifestyle. And so this is how medicine should be practiced. Find a plant-based dietitian, incorporate her or him onto the treatment team.
Yeah.
And now we're going to see people getting truly healthy because the food is the food is the food.
Everything.
And that now plant-based dietitians will step into the breach and provide that information. And it's easy to get frustrated, but a new wind is blowing in the dietary.
I'm so glad to hear that. Maybe down the line later down the line, but I definitely I love my online coaching program because I combine all of that, like eating habits, your lifestyle habits, sleeping, water, movement, exercise, all of that. So all of it's important for everything, but I do believe the first step is nutrition. Like with even people who are working out with injuries, things like I've had multiple injuries and I recover fairly quickly because of what I'm eating. So to help me. So I'm like, if you are somebody that is very injury prone or athlete, I always push the athletes to it too. Cause I'm like, you guys are the ones going through so much stress every single day on your bodies and you need to heal quickly to perform. So that should be the first community, but the Game Changers documentary is a great way to go about it. So no, I'm really excited for your book to be impactful on many people. They should make it part of a course. Like you should have to buy that book as part of a course. You're doing that? Are you doing that?
We're looking for a benefactor who we'd like someone to help us, buy 1,000 books, and every graduating medical student should just be given a copy of this book. And
So smart. It
right,
should be.
so, absolutely. So we're trying to get it into the hands of as many young medical students and doctors as we possibly
Good.
can. So
Good. I love that.
people are interested in our work, would like to support us or just learn more about it. I'm sure
Yeah.
you'll put
I will.
the movingmedforward.org. and you can help us with tax deductible donation if you'd like.
Yeah. Oh my gosh. So I will put everything in the link. Everything below, all the links. So the last 2 points, I had one question that somebody did ask you. So it was more so about they're 100% plant-based, rarely anything processed. I just gotta find the question. Okay. What is your approach to lowering cholesterol when it is familial in nature and already low dose statin therapy is being used, particularly within like a predominantly plant based diet? So, this person is 100% plant based, has been for 5 years, and they again have that, like low, they have higher cholesterol, just familial in nature. Sorry. That was the question.
Yes, it's an important question, one that I become very concerned because I had an artery scan done not too long ago, and I have some plaque building up in my arteries. And I said,
Hmm.
"How can this be? I've been vegan for 45 years." And so we did some further testing, and it turns out there's a kind of cholesterol known as LP little a that is a nasty, sticky cholesterol that damages the arteries and promotes inflammation, it promotes blood clotting, and it promotes plaque formation. And it's genetic. And I
Mm,
had mine done. You want no less. You want no more than I think 100 milligrams. I'm 160. With my dad died of clogged arteries. My brother died of clogged arteries.
mm,
That's it. We didn't measure their LP little a. Well, mine is too. And they're working on drugs to lower it, but what do you do about this? And the way to look at it is that uh, the LP little a and everyone should have their LP little a measured once in their life. That's all you need to
mhm,
do. Find out if you are high. I'll bet you this lady is. And it's like having an arsonist in the woodpile there. So what
uh,
do? Well, take away, using the arsonist analogy, take away the matches and the wood and the cardboard, anything that could be used to make a plaque, and take it away from the LP little a damage. So here's someone, and it's appropriate to be on statins
yeah.
to lower that cholesterol. Here's one place I've recently gone on them, and I think it's
Mhm.
appropriate to do. But anything else that injure those artery walls, plaque building up. It's not just a matter of how high is your cholesterol. The question is, how healthy are your arteries? Do you have that inflammatory fire burning in your artery walls that's fostering the plaque formation? And that comes from eating fried foods, eating refined sugars, fruit juices, candies, etc. The uh, oils in the diet, the cheap industrial oil, the safflower oil, sunflower oil that's used in all the processed foods and the fried foods. Those injure the arteries that allow LP little a to do its damage. So
Mm,
it'll remove all the other things. She should have an honest look at her diet as far as how many
yeah.
best meals she eats, is oils or there's sugar, if you're doing anything to damage those arteries. And if there's any question, again, it's one thing of wrestling those numbers down, but the issue is, again, not how high is your cholesterol, it's how healthy your artery walls. She should have either an ultrasound scan of her carotid arteries, or a CT angiogram, which a CT scan where the injection will dye into your vein. It's not a full angiogram, and see if she has plaque or not. If she doesn't, then even though that cholesterol may be high, it's not damaging her arteries. So she should,
Mm,
do everything she can do to keep all the other factors low, keep those
yeah.
sugars low. But don't
Yeah.
lose a little sleep, because it's not, because even though she's walking around with a cholesterol of 190 or 205,
Mhm.
it's not doing her any damage. So she should get her LP little a checked. There's another measurement called ApoB. I have that
Yes.
number
Yes.
of particles that can damage arteries. So she get her LP(a) checked, her ApoB, and then look at her, have an honest look at her diet, pull out everything else that could be damaging those artery walls. And she's doing all she can do to keep that
Yeah.
plaque holding up. But you can again do
Right.
a study to see if she has plaque or doesn't.
Yeah. That was a great answer. So thank you so much. And then we have one more. I like to finish off with the
Sure.
biggest three takeaways that somebody can leave from you, or what are your biggest three takeaways that you would like to share with somebody, maybe that they're not plant-based, or like what should they do for helping their health?
Right. Okay. As you say, eat more plants.
Yeah.
Okay. Have a
What?
big have a big salad every day. At least do that, and you can
Yeah.
really spruce up the salad. We have a big salad every day, and then we open up a can of beans or chickpeas and throw it on the salad there, and throw some ground flax seeds on there. So make that salad. And the salad, as Dr. Furman says, the salad is the main dish.
Yeah.
Have a big one every day. So definitely do that. Um, and again, health is more than the food. Food's important, but be balanced in the rest of your life. Take a walk every day. Get some sunshine. Get enough sleep. Don't generate excessive stress if you could possibly avoid it.
Mm-hmm.
And get as much love in your life as you possibly can. We're not here to suffer. We're not here to pound down our cholesterol levels. And harkening back to what we said, if we don't, it doesn't matter what your cholesterol level is, if we don't have a habitable planet to live on. And our
Mm-hmm.
meat-based diet, all these paleo folks and carnivore folks, everyone should be eating meat 3 times a day. And that's a recipe for destroying all our ecological futures.
Yeah.
So know that, get these other pillars of lifestyle medicine going in your life. And know the fewer animals you eat, the healthier we're all going to be, including planet Earth and our kids and their kids. We've taken a lot from this planet with our meat-based diet. It's time to start changing to a diet that really
Yeah.
helps heal the planet and our entire ecosystem.
Yeah. Well, thank you so much, Dr. Clapper. It's been such a pleasure. I just love listening to you and educate, and I've followed you for a while, so this was an absolute pleasure having you on today. So everybody listening, I am going to include Dr. Clapper's book below on the link, so you guys can order it. I'll include all the links that we talked about today, and I hope you all continue to keep living your best life. Thank you, everybody, and have a great day. Thank you so much for listening to the Best Life by You podcast with yours truly. I hope you go ahead and subscribe on YouTube, Spotify, and Apple Podcasts, and stay up to date with all the latest information. You can also follow me on Instagram at Julia_BestLifeByYou for more humor, podcast information, and all the above. I hope to see you soon, and let's continue to keep living